Hello, my name is Dr. Mustafa Ahmed and welcome to Southern Nevada Bariatrics. So today I want to give an overview of the practice that we have. Our main objective is to help patients lose weight, and we do that in several ways. The most popular procedure that we do is the laparoscopic sleeve gastrectomy, and this is essentially removing a portion of the stomach to help you lose weight. The other procedure we have, the laparoscopic room-wide gastric bypass. Now, this is more for patients who are more overweight than normal, as well as for patients who have severe diabetes and patients who also have severe heartburn. These procedures, the combination of these two procedures is probably about 80% of what we do here. And these procedures not only help you lose weight, but they also help you with your comorbidity. So one thing you have to realize is that a lot of people who are overweight is that you suffer from other comorbidities, including high blood pressure, diabetes, arthritis, heart disease, high cholesterol, and so on and so on and so on. So the whole point of having this procedure is to make sure that you have a long life, that you have a good quality of life. And that's what we strive to do here at Southern Nevada Bariatrics. The other procedure that we do that is also something that's on the rise is lap band removal. Lap band is a band that's placed around the stomach, and it used to be popular 10-15 years ago, but now it's not performed anymore, and it's actually removed. And then we convert, once we take it out, then most patients, we convert them to laparoscopic sleeve gastrectomy. And so that's another procedure that we can talk about once you come and visit us here. A couple of other things that we do here at Southern Nevada Bariatrics also includes doing hormonal therapy. So a lot of people, especially when you get into your 40s and 50s, may have a low testosterone level, and that may give you difficulty doing tasks, getting tired all the time, falling asleep all the time, having lack of sexual desire, libido. So we test you for that, and we also at the same time test you for many other panels within the blood work, including your white count and other things like your thyroid level, which can also affect your weight. So we do all of that as well. Here in this practice, one of the things we realize is that people who are having difficulty losing weight has a multifactorial approach to it. So it's not only weight loss in terms of just doing the surgery, but what's also important is having the support system, and which is something that we do here, that we have. So let me tell you a little bit about myself. I started off in life in the medical field doing primary care. I was a primary care doctor, internal medicine doctor. So I took care of patients who had high blood pressure and diabetes and arthritis, and I did that for 6 years. And I followed that up with doing a surgical residency for 5 years, and then I followed that up with doing a critical care fellowship, intensive care unit, and then I followed that up with a laparoscopic and a bariatric surgery fellowship. So when you see me here in the office, one of the things that's unique about me, unlike any other bariatric surgeon here in town, is that I'm board certified in internal medicine. So when I look at your medical record, I can see all the medical problems you have, and I understand exactly, and I look at your medications, and I know all of that just as much as a primary care physician that sent you to me does. That doesn't mean that I'm going to treat you for those. I leave that to your primary care, but I'm well versed in this, which other bariatric surgeons are not. So that's one aspect. The other aspect is that I'm also board certified in surgery as well as critical care. So I have a multifaceted approach to my practice. I can look at the surgical aspect, I can look at the critical care aspect, I can look at the primary care aspect, and I'm well versed in all of those. Unlike any other practice, all the bariatric surgeons in town, they're just surgeons, whereas I'm multifaceted. So that's the unique thing about my practice. Here at Southern Nevada Bariatrics, we're also, it's a very warm environment. It's a boutique clinic. I'm happy that you've watched this video, and I'm hoping that you will come and visit me and we can talk about how I can help you. So thank you very much for watching it, and please go ahead and look at the rest of the website, and I will go into detail about the different procedures. Thank you, and I hope to see you soon.